role with someone with type 1 or type 2 diabetes is, as their general practitioner, I like to see myself as a coordinator. So I help diagnose the condition, so look for it in the first place, help diagnose it, and then help the person living with diabetes navigate their journey through diabetes. So I like to get to know the patient, and that happens over many years, but sometimes I see people first off with diabetes, but I like to spend the time talking with that person, understanding what their lifestyle is, understanding what their knowledge of diabetes is. So we do it with a blood test, we diagnose it with a blood test, and then we may look at referrals. So the referral pathway can be referring the person diagnosed with diabetes to a diabetes educator. Also referring a person with diabetes to a dietitian, to a podiatrist, and to an ophthalmologist, an eye doctor, and often to a psychologist as well, because there may be different emotions that come up when a person is newly diagnosed with diabetes. And regularly, at least every 2 years, people need to be seeing a dentist. So that's the advice I tend to give to all of my patients. Similarly for an optometrist, a person to check the eyes, I like people to start seeing an optometrist even before school. So often with an optometrist, people may need to go more regularly, but at least every 2 years we say eyes and teeth need to be looked after on a regular ongoing pattern. If a person is having problems controlling their blood sugar level, or if there are complications with insulin use, for example, then I will refer someone on to an endocrinologist. But as an experienced general practitioner, I often manage my patients with diabetes in combination with allied health professionals, and often people don't need to go and see an endocrinologist. So part of my role is helping reassure people that if diabetes is well managed, that people can actually live quite a normal life. So it's reassurance, it's information, it's helping direct people to those correct referral pathways that I mentioned. But it's also many other things, such as treating the person living with diabetes as a normal patient. So that still includes things that I would do normally as a GP, such as blood pressure checks, skin checks, other medications, in particular looking for, say, for example, vitamin problems. Vitamin D deficiency is very common in Australia, so we will look for that. Also looking for other issues like vitamin B12 deficiency, which is quite common in diabetes because of certain medications that people need to use for diabetes. So it's what I call holistic care. So it's not just looking at pure sugar levels, it's looking at everything else, the person as a whole.